Alright, hi, this is Dr. No with Kid Focus Dentistry. So we decided to make this video because there are quite a few little kids that we see, usually about toddler age, that we see the tongue tie. However, we can't do the tongue tie release quite yet. And that's not really had to do with the procedure. It actually has to do with the success of the post-op exercises. It's just really hard for you to be able to do a successful exercises with these children. However, we still want to do something to kind of help your child along the way, especially if they are having some speech issues. So usually we like to use these exercises while your child are doing speech and in preparation for them to get a tongue tie release. So for example, most likely your child is around 2 years old. We are sending them to the speech therapist, and in the meantime you can do this exercise until your child is about 3 or 4. If they can just lay down the chair and comfortably let you help them with the exercises afterward. This would be a great time for this exercise that we're about to show you. Our main purpose is to really start getting some stretches and the tongue strength in there. So when we do release the tongue tie, it will be a lot faster recovery. You don't have to work as hard to rebuild some of the speech impediment that your child might have due to the tongue tie. First of all, we are going to have your child to do some stretches. So what we like to do is make sure that we stabilize the chin downward by using our thumb to kind of push it down. It's very easy for your child to want to cheat and move their tongue up by using the jaw, and that we're not getting that stretch. So first of all, you want to kind of help your child by stabilizing the chin. And then we are going to use a stick, or you can use a raisin. Basically, you put it onto the roof of the mouth and you're going to have your child stretch. So stretch as far as they can on there, especially if they have an anterior tongue tie that might be way too hard, but keep at it. So it just kind of like, if you think about you trying to do a stretch by touching your toe. If you can't do it the first time, you're not going to reach very far toward the floor, but the more you do it, the more you're going to get the stretches to be a little bit better. So that's the number one thing, is we want to do this as much as possible. I would recommend daily exercise on this and just trying to get the tongue up and up a little bit more. So the next thing that we would like to do is we're going to use our thumb, and we are going to roll the thumb onto the side of the attachment. So basically what the attachment is these fibers that are formed, and they are holding them down. So because they are fiber, you can stretch fibers. So you don't have to do it very hard, but you do want to use your thumb and roll back. If your child is not complaining, that means you might not do the stretches hard enough. What your child should be experiencing is they actually going to feel the sensations of tingling, some numbness on there. That is the very similar sensation to when you do a stretch. Like let's say you're trying to reach the floor. You feel that numbing sensation, very similar to that. The tongue is going to feel that way. Again, we're going to do the internal stretch, trying to get that to stretch up a little bit more. So lastly, what we're going to do is we are going to do some tongue pop. So again, a lot of time with these tongue ties, these kids doesn't like to move their tongue up. So the tongue tend to kind of always being on the bottom of the floor and go forward only and not upward. So what the tongue pop is we're going to hold down the chin, and we're going to have the tongue go to the roof of the mouth and create a pop. So the longer they can hold that tongue onto the roof of the mouth before it releases, the stronger that muscle is going to work. So we try to do this more often. This is a fun game that you can do with them when they are in the car. Have them do the ABC, trying to see how loud and how long the stretches can happen before the pop happens. So the more you do these kind of exercises, the more your child is going to be better and not being as restricted by the tongue tie. And hopefully by the time that they are ready to get the tongue tie release, in the chair, the post-op exercise is going to be quite easy. The recovery is going to be really easy, and you don't have to do as much therapy afterward to kind of recover normal function on their tongue.